hand sanitizer, all that good stuff. The doctor has put in a order to get vitals as well as a cardiovascular and respiratory assessment. Is that okay with you?
Mm-hmm.
All right, sweet. So go ahead and tell me your name and date of birth.
Ashley Alexander, 12/28/87.
All right, cool. So that matches a wristband, so that part's good. So I'm going to start off just getting vitals, which is going to consist of a pulse, respiratory rate, and a blood pressure as well as your pain scale, okay? So I'll start out with a pulse. Sweet. So for your pulse, I got 72, and your respiratory rate, I got 18, and I did both for 30 seconds and divided by 2.
Okay.
So next, I'm going to go ahead and get your blood pressure. And what does your blood pressure normally run, if you know?
Usually like 120s.
Okay, so pretty normal.
Mhm.
Alrighty.
Unless I'm at work.
Uh-oh, I'll flip it over. Sweet, so you were pretty spot on. It was 122/86.
Awesome.
So even though you're at work, hey,
Pretty
it's running pretty
Mhm.
good, I would say. All right. And so are you in any pain today?
Yes.
Where are you hurting at?
My chest.
Your chest is hurting?
Mhm.
Okay, on a scale of 1 to 10, how would you rate your pain?
It was a 9.
A 9 out of 10? All right. And
Pretty bad.
what would you say it feels like? Is it like a sharp pain, stabbing pain?
Sharp, crushing, tightening.
Oh, wow. So
All of
it's
it.
pretty bad.
It's pretty
bad. And does anything relieve the pain? Does it?
Yes, it's called Dilaudid.
Dilaudid? Okay, I'll talk to the doctor about that one. And also, does the pain radiate anywhere? Does it go to your back?
I guess
Does it
in
go
my
to your
back
sides?
and my left arm.
Okay. And how does it affect your everyday life? Well, how does it affect you when you're just living?
I mean, when it gets bad, it's crippling.
Yeah.
But I usually can still do what I need to do.
Pretty understandable. And lastly, last question about pain is, does it come and go, or is it there constantly?
It comes and goes.
Comes and goes. Oh, sweet. All right, so next I'm going to do a respiratory assessment on you. That I'm just going to listen to all your lung sounds, make sure everything sounds good, make sure there are no abnormal sounds with your breathing.
Okay.
So I'm just going to listen to 4 different places on your front side, your 2 sides, and then your back as well, okay? So every time I take a deep breath, every time I move my stethoscope, if you'll just take a deep breath for me. If you start to get lightheaded or dizzy, just let me know and we'll stop and take a break.
Okay.
Are you feeling short of breath at this moment?
I'm okay right this
All right, sweet. All right. Take a deep breath. Sweet. And if you'll lean forward for me. Sweet. And your lung sounds are clear in all 4 fields.
Okay.
There's no rhonchi or anything like that. And for the respiratory assessment, I did check the right upper lobe, left upper lobe, and then went down to the left lower lobe, then the right middle lobe, and then on the lateral side, I got the right lower lobe. So next we're going to move on to the cardiovascular assessment. Kind of the same thing. I'm just going to listen to your heart sounds, make sure there are no murmurs, and make sure everything sounds okay with your heart.
What's a murmur?
A murmur, it's something in your heart that makes a weird noise.
Okay.
But after that,
I shouldn't have that, right?
You should.
Okay.
No, that's not normal.
Okay.
And then we're gonna check your pulses and make sure you have no edema or swelling.
Okay.
Another word for swelling is edema. So, yeah, sounds good. All right, and I'm gonna listen to 5 different places in your heart. So I'm gonna start in the second intercostal space and listen to your apical. Now move over and listen to your pulmonic. I think I said that right. Then right now I'm listening to your, what's it called? Herbs point. And then your tricuspid. And lastly, your mitral valve. Alright, sweet. So now I'm going to do the same thing, but this time I'll be listening for murmurs, okay?
Okay.
Sweet. So everything sounds good. I don't hear any murmurs or anything in there. So next I'm going to just check your extremities. I'm going to check your pulses as well as check for any edema. Alright. And your pulse is 2+, which is just means it's normal. It's to be expected. It's a healthy range. And then I'm going to check your capillary refill, which is less than 2 seconds. And I'm just going to feel for any edema. Nothing on this side. I'm going to check your capillary fill on this side. Normal. No edema. And then I'll move down and check the pulses on your feet as well as capillary fill and edema. And the pulses on your feet are also 2+, which just means it's normal and to be expected. Can't really see your capillary refill because you have toenail polish on, which is okay. But I'm going to check for edema. Other places you can check for pulses is behind the knee and also your femoral artery, which I'm not going to check that right now because everything seems fine. So, but yeah, that ends our assessment. Do you have any chest pain or anything? That's one thing I did forget to ask with the cardiovascular assessment.
Yes.
You do? Oh yeah, we did ask that with the pain. So are you having palpitations or anything with it, or just the chest pain?
It's just the pain.
All right, sweet. Sounds good. Well, that ends this video. Sweet.
So after reviewing my video, I noticed that I did not educate my patient on using the incentive spirometer and telling my patient to take deep breaths every 10 times every hour. I also noticed that I did not check for jugular vein distension, and I will do that in future videos. So